In this video, I will be discussing 3 common heart diseases found in dogs and cats: myxomatous mitral valve disease, dilated cardiomyopathy, and hypertrophic cardiomyopathy, and I will be discussing the pathophysiology of each. Here is a very basic diagram of the heart, showing the right atrium, right ventricle, left atrium, left ventricle, vena cava, pulmonary artery, pulmonary vein, and aorta. It also shows the tricuspid valve, mitral valve, aortic valve, and pulmonary valve. The first disease is myxomatous mitral valve disease, which is the most common cardiovascular disease in the dog, and therefore an important one to be aware of. It is a slowly progressive degenerative disease. As the name suggests, it most commonly affects the mitral valve, although it can also affect the tricuspid valve and the mitral valve together, which accounts for 30% of cases. Very rarely it only affects the tricuspid valve. The disease is caused by nodules developing on the leaflets of the mitral valve, causing them to thicken. The mitral valve is made up of multiple layers. Histologically, the disease is caused by expansion of the connective tissue in the spongiosa layer, causing the nodules. Proliferation of endothelial cells and subendothelial fibroblasts can also be seen along with degeneration of the fibrosa layer. Overall, the mitral valve thickens, and as the disease progresses, the valve structure deforms and eventually allows regurgitation. The valve starts to leak. Therefore, during systole, most of the blood travels through the aortic valve to the systemic circulation, but some will regurgitate back into the left atrium. Therefore, when blood enters from the pulmonary vein during the next diastole, the left atrium dilates to accommodate for this increased volume of blood, causing an increased preload. When the atria contract, more blood enters the left ventricle. This volume overload of the left ventricle causes the ventricle to enlarge and stretch. Over time, there is ventricular remodeling, causing eccentric hypertrophy. As a quick recap, volume overload causes eccentric hypertrophy, which is where the lumen is increased in size and the ventricular walls are either the same or thinner than they were before. Pressure overload causes concentric hypertrophy, which is where the lumen has decreased in size and the walls are thicker. This, for example, may be due to valvular stenosis. The eccentric hypertrophy in myxomatous mitral valve disease progresses to cardiomegaly and eventually congestive heart failure. The cause of this degenerative disease is unknown, but appears to be genetic, with clear breed predispositions, with Cavalier King Charles Spaniels having a very high prevalence and developed the disease at an earlier age. There is also high prevalence in breeds less than 20 kilograms, for example, poodles, dachshunds, and chihuahuas. The second disease is dilated cardiomyopathy. After myxomatous mitral valve disease, this is the second most common acquired heart disease in the dog, and the most common cardiomyopathy. DCM is characterized by progressive enlargement of the heart chambers, starting with the ventricles and eventually the atria. This is due to systolic dysfunction. Histologically, it can be seen as 2 distinct forms, the first in which there is fatty infiltrate with degeneration and fibrosis, and the second where myofibers appear thinner and wavier than normal. This is described as attenuated wavy fiber. Overall, the diseased myocardium causes failure of one or both of the ventricles to contract during systole. This causes reduced cardiac output, as less blood can be pumped out of the heart. The ventricles then dilate to compensate. Again, this is eccentric hypertrophy. As the disease progresses, dilation continues. However, it gets to a point where the heart cannot compensate anymore and cardiac output reduces. This reduced cardiac output activates compensatory mechanisms, including sympathetic nervous system, aldosterone system, and the release of antidiuretic hormone. All of these act to increase blood volume, and this therefore increases pressure in the atrium, causing these to then dilate as well. This again causes cardiomyopathy and eventually leads to congestive heart failure. There are many recognised causes of DCM, but idiopathic is the most common form. This disease again has a genetic influence, with Doberman Pinschers having a high prevalence, but also many medium to large breed dogs, including Irish Wolfhounds, Foxes and Newfoundlands. Cats can develop DCM, but it is now rare as it was found that many cases were due to taurine deficiency. Hypertrophied cardiomyopathy is the final disease. This disease is important for cats. Myocardial diseases are the most commonly acquired heart diseases in the cat, and HCM is the most diagnosed. HCM is characterized by concentric hypertrophy of the left ventricle and intraventricular septum, without a concurrent systemic or cardiac disease, which would cause this hypertrophy. Histologically, it can be seen by disorganization of myocardial cells in the interventricular septum. It is primarily a disease of diastolic dysfunction, as the hypertrophied left ventricle cannot fill properly with blood, which causes increased end diastolic filling pressures. This transmits back, and this leads to increased atrial pressures, which then causes the atria to dilate. Again, this dilation of the atria can progress and lead to congestive heart failure. Cats with HCM can also get abnormal movement of the mitral valve during systole. It moves towards the interventricular septum, causing obstruction to blood flow out of the heart, and allows blood to regurgitate back into the atrium. This is called systolic anterior motion of the mitral valve, or SAM for short. This is often a cause of heart murmurs in cats with HCM, but not all cats with HCM will have SAM. This disease again has a genetic predisposition, with Maine Coons and Ragdolls having known genes which contribute to the development of HCM. However, due to domestic short and long-haired cats being the most common type of cat owned, it is most commonly seen in these cats. So to recap, overall, myxomatous mitral valve disease is a primary degenerative disease characterized by mitral valve thickening, mitral valve regurgitation, and eccentric hypertrophy of the left ventricle. Dilated cardiomyopathy is characterized by enlargement of all heart chambers. It is a disease of systolic dysfunction. Hypertrophic cardiomyopathy is characterized by left ventricle concentric hypertrophy. It is a disease of diastolic dysfunction and may involve SAM. All three of the diseases can progress to congestive heart failure, and all have breed predispositions.